When the heart beats too slowly or irregularly, even simple tasks can become dangerous. Tests reveal the heart's rhythm is not reliable. A pacemaker is a small device that helps control abnormal heart rhythms. The procedure is explained, including benefits and risks. The implant site is sterilized to reduce infection risk. Medication is given to keep the patient relaxed and comfortable. Pacemaker implantation usually takes 1 to 2 hours and is minimally invasive. The procedure takes place in a specialized cardiac lab. A sterile environment protects the patient. A small incision provides access for the pacemaker leads. The leads are guided through a vein toward the heart. These leads deliver electrical impulses that regulate the heartbeat. The surgeon positions the lead precisely inside the heart chamber. The lead is tested to ensure it stimulates the heart correctly. A small pocket is created beneath the skin to house the device. The pacemaker sits just under the skin, usually near the collarbone. The leads are connected to the pulse generator. The device is placed into its protective pocket. The pacemaker is programmed to match the patient's needs. The incision is carefully closed. A dressing protects the area during healing. Most patients return home within 24 hours. The medical team monitors heart rhythm after surgery. Movement begins slowly to protect the implant site. Imaging confirms correct positioning. Pacemakers help prevent fainting, fatigue, and dangerous heart rhythm problems. Most patients resume normal life within weeks. The device is checked regularly to ensure proper function. Energy and confidence often return quickly. For many, a pacemaker restores independence and safety. A steady heartbeat can mean a fuller life. A pacemaker transforms irregular rhythm into steady beats. From walking to traveling, normal life returns. Modern pacemakers are safe, reliable, and life-enhancing. Every heartbeat matters. Consult your cardiologist for personalized advice. Stay informed, stay heart healthy.